As a clinical research associate, I think a lot about how we can ensure data quality in our trials. Because at the end of the day, our trials are only as good as the data they produce. One of my greatest concerns is that when I am monitoring a clinical trial, I am meeting the regulator's compliance standards. But my days on site are overwhelmed by source document verification, or SDV, and I spread myself thin juggling site visits that seem unnecessary. I oversee 20 sites that need to be visited every 4 to 6 weeks, and I have different monitoring plan expectations for every study I monitor. I spend so much time on excessive SDV that I don't have time to focus on really important site issues like enrollment or problems with protocol conduct. I'm often forced to rush to sites to resolve last-minute issues and queries before interim analyses or database locks. And even when my study is a focused SDV plan, I don't know which site to prioritize or which subjects or problem areas to consider first when I visit the site. I hear everyone talking about risk-based monitoring, but I don't even understand what the risks are in the trial.
I work for a major CRO that relies on several different systems for monitoring our customers' sites. This means multiple passwords, fear of duplicate reporting, and a litany of unique SOPs. We want our most important stakeholder, the patient, to have access to safe and effective therapies, which only happens when all other stakeholders, the sponsor, the site, and the regulators, are confident with the data quality. And the only way this happens is with a sophisticated targeted approach that rethinks our approach to site monitoring.
To ensure the highest quality in our clinical data and compliance with ICH E6, our organization has partnered with Medidata to transform how we work, supported with the latest digital health platform. I'm now able to access everything via single sign-on. We've made a couple of other changes, documenting a risk assessment and adopting a central monitoring approach. The risk assessment helps us agree upon the potential risks associated with trial endpoints and to consistently mitigate those ensuring patient safety, as well as adequate informed consent.
We're making real-time decisions about site visits, spotting issues that were once overlooked or found too late. We're saving time and money by conducting 4-course on-site visits only when needed. When we do go on-site, we can focus on what is most important. We're getting a more holistic view of our data than we thought possible. As a result, we're monitoring all our trials in a consistent way.
Gone are the days of a mad dash at the end of trials to prepare data for FDA submissions. We're fixing errors in real time and avoiding the loss of patient data. With a centralized approach, our data managers, site monitors, and biostatisticians are working in step like they never have before. Now, when I hear from my central monitor about queries at a site, I know how and where to respond, with no second guessing, because we're looking at it right on the screen. We are seeing the next generation of clinical trials, and with a centralized approach, we're ready.
ICH E6 guidance is clear. A strategic monitoring approach is the only way forward to keep up with rapidly evolving data types, whether it's genomic data, mobile health, imaging results, operational or site data. We're ready for what comes our way.